Hello, my name is Kellen Tropeck, and today I will be explaining why testosterone replacement therapy should be more easily available to individuals that need it. Alright, so let's get started. So what I want to talk about first is what is it exactly? Testosterone replacement therapy, or TRT, it is a treatment used for men with symptomatic hypogonadism. What this disorder is, it affects libido, muscle mass, strength, and it can also cause osteoporosis, depression, and whole body fatigue. This is because your body isn't producing enough natural testosterone. And this can happen for many reasons, from undescended testicles to cancer treatment. And there are two types. First is primary, and primary is caused because of the testicles are not producing enough natural testosterone, and secondary is having to deal with the pituitary gland. Next, I want to talk about how to tell if you have it. So first of all, before you make an appointment to get blood testing done, you want to see if you have several symptoms. This can range from the things I talked about in the first slide, dealing with muscle mass, sometimes depression, and whole body fatigue, to things like gynecomastia even. So if you think that you have it or suspect you have it, you want to get blood testing done. The doctor will then see if you have any abnormalities in your blood, this being like low testosterone levels. Further testing the doctor may want to do to see if it's primary or secondary. These tests may include hormone testing, semen testing, pituitary imaging, and testicular biopsy. So currently, testosterone is considered a Schedule III drug under United States federal law. This means police won't necessarily be raiding your home if they suspect that you have some, but if they do catch you with it without a prescription, you are subject to a minimum penalty of 1 year in prison and a $1,000 fine. Testosterone prescriptions are also really expensive if you don't have health insurance. Sometimes the price range can differ a lot depending on which region you live in and which doctor you go to, but the highest that I've seen on the internet someone's paid is $1,000 monthly. And some people may not be able to pay this, so they would rather turn to the internet and order stuff from other countries. You can get testosterone from Europe, Russia, and even Mexico, and some of these testosterones can contain mystery components such as human DNA, rat feces, and a lot of oil that you don't need to be putting in your body. And being in the powerlifting community, I've seen some guys order their stuff from different countries. And I even have close friends to me, two of which need TRT, and one of them doesn't have the health insurance to get it, so he orders his stuff online. So for testosterone to become more widely available, there's a couple things that need to happen. Testosterone, I believe, should be decriminalized. I understand that it can be abused, but most of these guys that are ordering it online and stuff because they don't have health insurance, they just want their normal testosterone levels so they can go through their daily lives without feeling terrible. The price of testosterone in the United States, especially for prescriptions, I feel like should be lowered. I've seen some places online where you can order a 4-week cycle of injectable testosterone for under $100. And lastly, I feel like taking testosterone, testosterone shots, orals, anything like that, it shouldn't really be considered taboo anymore. And there needs to be a lot more accessible information for guys out there that are wanting to understand how it works and how they need to put it in their bodies if they can't buy it or get it on a prescription. And with testosterone becoming more accessible for men, there can also be more studies done on how this miracle drug works. I feel there are more upsides to all of this than there are downsides. Yes, you have several symptoms that you can get by taking testosterone, but like all drugs, there are symptoms. And these are my references where I got all my information. Thank you for listening to my arguments.